As I already said, I believe that there is a very perverse incentive for health insurance companies largely to actually see premiums go up. And when I see billboards, when I drive down the expressway, and they basically say, I said this to Charlie Baker long before he was governor, when he was running Harvard Pilgrim, and there was a billboard on the expressway with his picture on it, and it talked about how wonderful the care was at Harvard Pilgrim. And to make it a little less personal, I said to him, hey, Charlie, nobody was ever cured at Blue Cross. You know, people are cured by doctors and hospitals and providers, not by a health insurance company. And I feel strongly that health insurance companies need to know their place. And what I often say to them is sit in the corner and look pretty. Because the fact is, they do have a service. They can coordinate networks of providers. They can negotiate discounts. But oftentimes, too often, when you really look at the data, the discounts that they negotiate, they do not pass on to employers and consumers. They keep it. So I have a significant problem with health insurance companies standing up in front of groups of people like this and talking about how hard they work to preserve cost for you, because I don't believe it. And largely, I think physicians respect and providers respect other providers and best practices, and not some suit from an insurance company. So I really do believe as this country evolves, we will be seeing changes in the role of insurance. Now, the insurance industry is a mega industry, and I will tell you, I've very rarely seen politicians who have an appetite to take it on. So I'm not sure we're going to live long enough to see material change. Others think we will, and that our society will move closer to a single payer system. And I'm not even telling you I necessarily believe that single payer is the answer. But what I don't believe is when insurance companies write benefit plans that say to everybody, you can have whatever you want, whenever you want it. And that they do it because it makes the insurance company more attractive to the business that buys their insurance. A very prominent health insurance executive in Massachusetts once told me that he couldn't reduce the benefit designs and therefore the cost because the employers didn't want it. And I looked at him and I said to him, you're taking 10 cents off the top of every dollar for yourself, for the infrastructure of your insurance company. You are being paid to educate the business community. That's what you are being paid for. And for you to abdicate your responsibility and simply throw your hands up and say, I have to write a benefit design that gives people what they want, that forces consumers to fight with their doctors over what services they get, it's fundamentally wrong. So now there's some folks here from Minuteman, and Minuteman is a little insurance company that I have the privilege of working with. And it is part of the Affordable Care Act. And when President Obama pushed the Affordable Care Act, he really wanted a public option. And he didn't get it. And he was able to put several $billion aside for every state to start a not-for-profit competitive insurance plan where the profits, beyond the risk-based capital, had to go back to the consumer or had to go to increased benefits for the consumer and not be pocketed by the plan. That's the kind of insurance mentality that I think we need. And I won't go into all the trials and tribulations of working with the federal government to try to get this thing launched. But having said that, it was what juiced me up about Minuteman was the idea that consumers would ultimately benefit from insurance as opposed to a bunch of suits. And I'll tell you, one Christmas I was negotiating with an insurance plan, and it was like Christmas Eve day, and snowing. And I went to this executive's office that was rather palatial, and there was nobody there. Everybody went home because it was snowing. And I said to him, well, back at my shop, everybody's there because hospitals never close. And it was, so therefore, there is a mentality in the insurance world that I think personally needs to change.